Welcome to the Sunshine Training Center. For tips, how-tos and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. In this short video, we'll demonstrate how skin tension caused by scars can affect joint movements. We'll focus on shoulder joint. This demonstration was prepared by Vida Tu, occupational therapist and project manager at Sunshine Foundation, as well as Li Chong, occupational therapist at Sunshine's Taipei Rehabilitation Center. In online courses like The Impact of Scar Contracture on Multiple Joints, as well as in previous blog posts, we've often emphasized that skin is a continuous unit. For this reason, when a joint moves, it's not only the local skin over that joint that will be stretched. Skin in areas adjacent or further away from the joint will also be recruited. The presence of burn scar will affect joint movement, because unlike normal skin that has sufficient elasticity to stretch, scars lack elasticity, and also tend to contract towards the center. However, a scar doesn't necessarily have to be located directly on a joint to affect its movement. In the case we will present, the patient has obvious issues with shoulder joint movement, but the surrounding skin does not seem to have scars. Yet, uneven tension produced from scars located elsewhere can still be observed. When the patient performs shoulder flexion, as the range increases, we can see that the skin under the axilla towards the back shows signs of heightened tension. Although there are areas on the back where skin was harvested for grafting, there are no hypertrophic scars, and the skin's extensibility should not be affected. However, when the shoulder joint moves, it shows uneven tension, which must be affected by continuous scars in other areas. There is no hypertrophic scars in the armpit area, but you can see that the skin of the armpit is stretched in the direction of the upper arm, pulling the skin of the armpit and chest into a band shape. The scar on the upper arm extends continuously to the forearm. This raised and rigid scar restricts the movement of the elbow and wrist. Although the scar is not directly located on the shoulder or armpit, its tightness and lack of elasticity causes the armpit skin to be affected, resulting in uneven tension and band-like appearance. When shoulder abduction is combined with elbow extension and forearm supination, we can see that each movement is more difficult. The patient started using trunk lateral flexion to compensate, and the band-like tension of the skin at the armpit became more obvious. Also, if we observe closely, when the patient performs shoulder flexion, the scapula is not stable and there is excessive upward rotation. In addition, scar tightness on the front causes the patient to assume a round shoulder and forward head posture, which will affect the scapulohumeral rhythm and affect the performance of shoulder flexion. The patient requires strengthening exercises targeting the rhomboids and middle trapezius muscles, while the anterior scar requires stretching to improve posture. For more details on the shoulder's scapulohumeral rhythm and the management of burned shoulder, there is a series of online courses on the management of the burned shoulder. Through this case video, we want to remind everyone to pay attention to two key points when performing scar management and joint exercises. First, when joints move, the skin that will stretch is not only the skin in the joint area, but also the skin in adjacent areas. Second, skin without hypertrophic scars may still be affected by surrounding hypertrophic scars in other areas, which ultimately leads to restriction of joint movement. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation-related tips and videos, and visit our website for news about our latest training programs.